What happens at Resilience isn't the same reality as the Native Women's Shelter. We're in the same predicament because of COVID, because, we had one staff get COVID, and during the first wave, we had to close down for 2 weeks because of so many staff getting sick. So, I love the idea of the residents empowering themselves and supporting organizations. And I think for resilience, that's key. So for the Native Women's Shelter, when we have COVID positive cases for the clientele, it's really hard to send them anywhere. So I know that in Montreal, they have a stadium that is divided into cubicles, and there's a small section for men. I'm sorry, there's a small section for women, a larger section for men, and nothing for families. So yesterday we were scrambling, trying to figure out what we're going to do with this family that became COVID positive. We could not send them there, and there's nothing in place. There's one shelter, but it's not really suited for children. And our only other option until the government decides to create something is for us to send them to self-isolate as a family at a hotel, and for us to pay for the hotel, for the travel, and for the food. That's where we are right now. And yesterday we had a memorial for Raphael Andre, and I spoke to the city officials and brought this to their attention that right now we're scrambling. So the thing is that, just before Christmas, that's when the new variant was introduced into the community, that people were starting to scramble. And I brought this, to the attention of different people, saying, where are we sending the women and children? So now we're, mid to end January, and nothing has changed. So I don't understand why there's the lack of either initiative by the government. During the first wave for the Native Women's Shelter, when we had to close the shelter for 2 weeks, there was a designated hotel by SOS Violence Conjugale that was for women and children. So when we closed down, we sent all the women and children there. And upon reopening, they came back. Now that hotel does not exist anymore. That service does not exist. I'm not exactly sure why, when, the fifth wave arrived, that did not spring back into action. So it's not a really good time for families. Like, if they get COVID, it's panic. Where am I going? Where am I going with my kids? I can't imagine going to a stadium with small children, and it's just a big giant room with dividers. Kids are going to run around and they're going to try to be entertained somehow. Everyone has COVID. You're going to have to self-isolate. It's chaos.
When you mentioned this hotel, when did it stop serving the community? At the end of last winter?
I don't know exactly, because we only used it for X amount, but I think that during the first wave, there were a lot more hotels that were designated for the homeless population, and also for, women facing violence. So I think that when they started lifting measures, when we started getting out of the red zone, that's when the government started closing all these hotels. I mean, Marché Beausecours used to be, a place for the homeless to go to, so was, Place du Puy was a hotel that the homeless could go to. All those disappeared. So I would say that it disappeared at the same time, if not earlier.
Thank you. I just want to go back to something you said. When you said they lied, are you talking about the government?
Lied about what?
So when I first asked the question about lack of government support in the grassroots movement, you mentioned that they lied.
I don't know if I lied. You have to go back. They lied about what? Maybe it's because I have a like I don't know, I'm a little, maybe it sounded like I said lied, but I don't know
Okay.
if I said lied.
It
But
would it apply to the situation of David saying the government isn't providing support?
I don't know. I mean, the government is in small doses, right? They are providing. So I would definitely take a look at that line about me saying they lied, because I'm not sure how that really fits into it. But during the first wave, there was, maybe 25 additional resources for COVID. Now, I think there's two, right? There's like some stadium and then another place, sort of like, I don't know where, but I think there's two designated spots. That's it. So when you think of all the other places that they had during the first wave for the homeless population, all those disappeared. Um, so I'm all confused about the lied word. Like, I'm not sure how I,
That's okay. Well, I'll just cut it from my brain.
yeah, just edit it. Just get rid of it. You can edit this, right?
Yeah, I won't use
Okay.
the whole interview. I I guess I want to double check. So I know that you said the situation at Resilience is different from the Native Women's
Yeah.
Shelter, but one of the things David did mention is that instead of due to a lot of employees having COVID, he said that instead of the government, sending more people to help out, they essentially send public health to ensure social distancing. And he's essentially like, this doesn't really do anything. Has anything similar happened at Native Women's Shelter, or just similar in the aspect of, not really meeting the needs, but just sending, I guess, whatever?
Our experience is very different than Resilience. So I know when we had to close down, we asked the CEOs to come. We asked them many times, can you come? Can you help? Can you send staff? Can you send someone? Can you send us, PPE? Can you send us, information? Can you send us? We didn't get anything. We had to find our own solutions. And it was only because there was a social worker designated to Resilience from the CEOs. She was the one who said, oh, I know of a place where you can all go. So I had many conversations with the CEOs and public health about trying to find solutions during the first wave before we closed down, and nothing panned out. It was a separate social worker that knew of the SOS violence conjugale, and she referred us. So, I mean, in our experience, they come in after the fact, right? And what we had to do when we closed down was, work with the Architecture Sans Frontières had special funding for COVID, and they would come in and assess the place and figure out where to put the plexiglass and all that, and design it COVID for COVID protocols. So we had to, arrange all that. And then basically, when we reopened, the CS came in, they looked around, they're like, yeah, it looks good. I'm like, thanks for nothing. But that's our experience. But the thing is that it's because it's two different organizations, you don't have to worry about overcrowding at the Native Women's Shelter. We have X amount of people in the building. We only have 13 bedrooms. So it's not the same thing as Resilience that has, up to 300 people walking through every day, right? So I could see where public health is more, or the CS is more concerned about, the virus spreading there. So I don't, yeah. I guess, they're, instead of help, they're a little bit more ensuring that protocols are being followed, but not really supporting what needs, to continue to ensure that the organization is able to fulfill the needs, right? I mean, Resilience was closed for a week, and that was really hard. Like the clientele had nowhere to go. Everywhere closes, but this new variant is so contagious that everybody's getting it. People that are double, triple vaxxed, they're getting it. So you have to kind of find a happy medium of taking care of your staff, but you also got to take care of the clients, and how do you do that in a way that meets everyone's needs? It's definitely not easy.
During the fifth wave, what would you say are, the biggest, like the top of the list of what the Native Women Shelter needs? And maybe if you're also willing to comment on just overall needs for the homeless community in Montreal.
What we need is a designated spot to refer Indigenous women and their children. That doesn't exist. That is our number one need. If someone gets sick with COVID and their children do too, where do they go? And it needs to be created now. I mean, you have to understand we have women that are designated with their children by youth protection to the Native Women's Shelter. If we send them elsewhere, we have to call youth protection. What if they're like, well, we don't approve of this spot, so we're going to take the kids, right? Like it's not easy. So if the government designates this spot as women and children, then it'll be easier for Batshot to allow these kinds of things. Obviously we always need more rapid tests. That was something that was the government gave us X amount of rapid tests. I think they gave us 50, and now we have to test the new people that come in, and then the current population, and then probably like on a weekly basis, just to make sure, because every time you go out you can get it, right? You come in. So we need more rapid tests, more the N95 masks, and I guess that's it. We always need more staff, right? So recruiting, but people that are qualified to work in this, that have experience. And then your other question was?
I guess instead of just the Native Women's Shelter, overall, just in your dealings with the homeless community in Montreal, is there anything outside of what you mentioned that you think is really vital for the government to provide?
Well, I mean, obviously at Cabot Square, we need to turn the Raphael Andre Memorial Tent into a shelter. That hasn't happened yet. We're going to be there until at least March 31st, but it is really cold out. So in the tent, they have like 15 places where people can rest, and about 300 show up. So that's a lot of people walking around outside in the cold waiting to come in. And that's a lot of staff outside with them trying to keep them warm. And we need a permanent solution. And what's difficult is that the government will create, an Indigenous shelter like PAC that's going to be opening next month in February, but it's going to be in the Saint Laurent area. That does not help the clientele that come around Cabot Square. They're not going to go there. And so you need to serve the people where they are. So, we also need more wet shelters. We need more shelters that allow the population to come in intoxicated, and then to help them with that. Instead of saying, sorry, don't bring your booze or whatever, these rules is, having a professional there to assess them and monitor them. And they have these in Ottawa and Ontario. We need to have, Indigenous led for, 50 to 100 people, something more overnight, because a lot of people are in the metros. They're just trying to find someplace warm. And that's not a solution to just, be in the metro overnight. It's exhausting, like to always be searching for some kind of warmth, some kind of food, some kind of kindness. So we need to provide that, a place where they can come in and just, all right, rest. And mostly for the evenings. We do have day centers, but we need something for the evenings in the Cabot Square area.
I just want to double check, turning the Raphael Andre Memorial Tent into a permanent shelter. Would this be a building, or even okay, it would be a building. Okay, so I guess it would essentially be having to find a space in the nearby area. Okay.
Yeah, and I've been asking the mayor since April for a space, and nothing has come up. So yeah, I'm not sure what it is, if it's like the lack of will, because the mayor said that they put ads out looking for places and no one actually answered the ads. So, but if you look in and around the area, there's a lot of empty storefronts. So all those storefronts could be getting rent, right? But no one is picking up on that. I mean, you have the AMC, forum or theater or whatever across the street, lots of empty space in there. I think there are solutions that are easy, but it's just, I don't know, I'm not sure why it makes people uncomfortable to want to support a population that really needs the help, but we have a lot of workers that are willing. And the thing is that, there's about 22 staff maybe at the Raphael Andre Memorial Tent. If we open a night center, night shelter, they're moving in. They're all coming, like all this staff. So staffing is not an issue. We got the people. We got the dedicated people that clearly know the residents that come to the Raphael Andre Memorial Tent. We need a location, and we have the support of the Innu Nation, the Mohawk community of Ganawage. The chief signed a resolution that they are behind the tent. Makavik. So we have a lot of political, like indigenous political leadership and pull. We just need a space. So please give us a space, somebody.
Thank you. And just to backtrack on what you said about Batshaw and youth protection needing to authorize the space where children are going. I'm gonna check with Batshaw, but just given that Batshaw is Batshaw, I want to ask you, what are you seeing in your experience are the reasons that they won't approve a space and take a child?
Well, the thing is that, if a mother if the Native Women's Shelter is able to convince the social worker that we will keep them safe, then they'll allow the woman and child to stay at the shelter. If we say they have COVID and they have to leave, Bacha might be like, well, we never agreed to plan B. We only agreed to plan A. So I need to take a look at plan B and see if I think, and when I say I am talking about Batshaw, that is the appropriate place and supervision and all that. If it's not there, I'm not allowing that. Let's put the kids back in youth protection or back into foster homes.
That makes sense. Thank you for clarifying. I guess lastly, I just want to ask, since we've already kind of, yes, Omicron is worse, but since we've already been through this in the first wave and the many other waves last winter, are you surprised? Are you disappointed that, the government is only providing 2 spaces? They're kind of like scrambling to deal with everything at the moment.
What I find interesting is it feels like they haven't learned anything. Right? They did better during the first and second wave. They already had all these designated spots. Even the curfew, right? Like I find it really ironic that, when Raphael Andre passed away, it was because of the curfew. And, the anniversary of his death, which was Monday, was when the curfew was lifted. And I'm like, does the curfew help anyone? Because we know that it caused a lot of stress. And if we had more services during the second wave, and this 5th wave is really affecting, the population in terms of numbers and deaths, why would you only have 2 spaces? Why would you offer less services during a crisis time?